right. Can you introduce yourselves for the tape?
Hi, I'm Frances Lee.
I'm Stephen Macedo, and the thesis of our book is that we need much more careful consideration next time of the costs as well as the hoped-for benefits of measures like lockdowns and school closures, and more open debate about these matters.
Well, we really, really appreciate y'all joining us. I'm really excited for the conversation. Your book was one that really got our attention and got us thinking, and we were really excited when you agreed to join us for a conversation.
Yeah, thanks guys for joining and talking to two lonely epidemiologists over here. I think that Abdul and I had a lot of learned experiences and learned lessons, and a lot of firsthand accounts. And so we are more than happy to have this conversation. Thank you.
Well, thank you.
Thank you.
So one question we had was just, it's helpful to understand sort of how each of us experienced the pandemic. I know I experienced it from my in-laws' basement, doing, really just interview after interview after interview, trying to understand what was happening, to read up, and then to explain. I know Katelyn's was somewhat similar. What was your lived experience of those first 3 to 6 months of the pandemic?
Well, I could say first that my experience was not bad, and indeed I was not hypercritical or skeptical of the measures. I was working on other things and thinking about other things and sort of going with the flow during the COVID pandemic. There were things that I was not entirely sure about that were coming out of official messaging, including the doubtfulness of a lab leak of the virus. But I was not thinking like an academic, particularly about these matters. I had courses to teach online and conferences to go to and so on. So I was at this rather comfortable place that I am at the moment, and having meetings canceled was perfectly fine as far as I was concerned. I was only teaching a seminar online, and that wasn't bad either. So I have to say I had a kind of normal experience for members of the privileged laptop class, and in some ways I welcomed the peace and quiet. I'm sorry to say that, but it was obviously a traumatic period going to the grocery store, having the groceries bleached, and being concerned about carrying virus in your clothing and so on. There was a lot of anxiety for sure. But my experience during the pandemic was that of a fairly normal professional going with the flow and doing the best I could.
So I remember when we were sent home from the university at midterm in spring 2020. So I went back to Washington, D.C., where my husband lives. And, that was would have been the start of our spring break, but they announced that we wouldn't be coming back immediately afterwards. And so settled in. Now I had doubts about the effectiveness of the measures that were being taken. I could see that the virus had spread all around the world and all around the country. I mean, the news was coming in, making that entirely clear. And I'm thinking to myself, I just don't see how what we're doing is going to contain it. And so I just have these doubts, which are consistent with the sort of questions that I had asked professionally around questions about government policy, whether it's effective, whether it has unanticipated consequences. Those are sort of bread and butter questions for somebody who works in a policy school and teaches courses on national policy making. And so I had those doubts. I could see that a lot of other people were working in person. They had to for society to continue. And I'm thinking to myself, I don't know when we're going to be able to go back to the university or when things will reopen, because I don't see how this gets under control.
So I'm an epidemiologist, and I know that one of your guys' themes of the book was the criticism around politicians who didn't necessarily question epidemiologists and other scientific experts. And I'm curious that since writing the book, I know you guys have been doing a ton of speaking engagements too. Have you spoken with any of these elected leaders who made these decisions, and you would, have told you about the logic they used at the time and how difficult those decisions were from their political perspective?
I mean, I'll just say we haven't spoken to a lot of elected leaders. We've spoken to the public health official from Mississippi, and Frances can perhaps talk about that. We have spoken a bit to decision makers in universities who also had to make these policy decisions in those smaller settings. And, they were making decisions now. The ones we've spoken to are highly resourced institutions with a special concern for the well-being of their own students, a lot of resources to spend, and also keeping an eye on what other peer institutions are doing. And obviously, those people, intelligent people, were getting advice and did what they thought was right for the sake of protecting their own students. These were not typical decision makers, the ones that I've spoken to, because again, we're talking about highly resourced universities with focused concern for their students in particular. But we understand that there was a lot of fear at the point of the decision making, and people were doing the best they could. We do think that it's surprising that people didn't pay more attention to the pre-COVID pandemic planning documents, which were many, and we're skeptical about the efficacy of these lockdown measures, as Francis was from the start. And we're emphatic about the costs of these measures, including for students and especially for students from poorer backgrounds. So there was, there were guidances out there. And it's very surprising to us that the Chinese model wound up wielding such great influence as compared with the decades of careful study of the efficacy of these kinds of measures that was available.
I'll just say that our approach to writing the book was not journalistic in the sense that we didn't go out and systematically do interviews. We wrote the book on the basis of the public record, the data that we could compile, and the studies that were available. So it's an academic book that relies on those sorts of sources rather than on reporting.
I want to jump in because a lot of the book centers on the efficacy of non-pharmaceutical interventions. And just for listeners, what we're talking about here is everything basically. It's not vaccines or medications, right? We're talking about lockdowns. We're talking about masking. We're talking about stay-at-home orders, testing, right? These kinds of interventions. You make the argument in the book that there was a consensus about their efficacy or lack thereof. And I guess I struggle with that only because the efficacy of an intervention is really a function of how people perceive the disease to be, and frankly, the nature of the way the disease is transmitted. So it's helpful to me, at least, to recognize that we didn't know what we were dealing with at the time we were dealing with it. And so one could imagine that we were dealing with something like Ebola, right? Ebola is an extremely deadly, pretty transmissible, though not as transmissible, admittedly, as COVID-19, given that it's not airborne, but also a really scary disease, like the kind of disease that kills you because you are bleeding from your eyeballs kind of disease, right? And I imagine that if we were dealing with something like Ebola, and that happened to be the epidemic that hit, that if public health officials didn't say, lock down, protect yourself, stay home, people would think we were insane. And if we did say it, people would be a lot more likely to actually do it because of how scary Ebola is. And so it's hard for me to disentangle the efficacy of an intervention, or to think about the efficacy of an intervention in a vacuum, right? Or to disentangle it from the disease that we're talking about. And I guess, had we been talking about a disease like Ebola, right, I wonder whether or not you would still agree with the idea that these kinds of NPI interventions are just not effective from the jump.
Well, let me just make a couple of comments about that. One that Francis back in. We were getting some information from the Princess cruise liner that was quarantined in the Japanese harbor. Michael Osterholm was saying in mid-March that the virus is aerosolized and will not be possible to contain effectively. He was also pointing out that the measures would be extremely effective. We discussed in the book that there were quite a large number of dissenters from the policies. Eminent scientists, Tom Frieden, Greg Gonsalves, who later became a great believer in the lockdowns, were writing pieces in mid-March saying the Chinese must be getting bad advice. They're not doing the sorts of things that have been recommended before, and we could never make these measures work, bolting people into their apartments and so on, in the West, and the virus has already traveled too far. So, in fact, there was disagreement early on, and there were many that were pointing out David Katz of Yale, Justin Lesler of Johns Hopkins University. There were many that were pointing out in March, and we quote them in the book, making reasonable suggestions about the unlikelihood of the effectiveness of these measures and their costs. Of course, with masks, we had the Cochrane reviews that had been published for decades. Its fifth revision was scheduled for publication that spring, 2020, and it was postponed for various reasons having to do with some politics among the editors of the journal. But there was we admit that it was a bad pandemic. It was a bad virus. A certain amount of fear was totally understandable, but there was also an opportunity to learn, especially over the summer, and we're surprised that didn't take place.
I did want to jump in on the question of Ebola versus respiratory pandemic. That what we were looking to as far as pre-pandemic plans were concerned were those aimed at dealing with a respiratory pandemic. That was the planning that had been done in the George W. Bush years. That was also those are also the plans that we referenced from the World Health Organization in 2019, which so they were calibrated to questions about how to contain a virus or how to deal with a virus that's transmitted as a respiratory virus. And that 2019 report goes through each of the proposed non-pharmaceutical interventions that had been suggested as possible responses and lays out the evidence base around each one. And in each case, they note that the evidence base is weak, it's poor. And they designate some measures as not recommended under any circumstances in the context of a respiratory pandemic. And those were testing and contact tracing, border closure, and quarantine of exposed individuals. That all of those were seen as unlikely to succeed and having high costs. Even if we go back to the George W. Bush era planning, that's where you get the term, the early targeted layered non-pharmaceutical interventions. So why early? If they're not imposed early, then you can't have much expectation of success. And of course, we don't know here in the U.S., or in fact, even around the world, we don't know for certain exactly when this virus began to spread. We know that there's evidence of in blood banks from December 2019 that it was already here. So when you're looking at several months of spread before any measures were taken.
I think you take for granted that we understood that this was respiratory based on a little bit of initial evidence, because this was all at the same time that we were still wiping down our bananas. So I just want to be clear that you can argue that we should have used data about a respiratory illness, but we had very limited evidence about whether or not this was a respiratory illness. We had some evidence that was suggestive, but not all.
Yeah, I think I would like to insert an example, if we're talking about respiratory, that is measles. Right now, we use all of these interventions for measles transmission, and it's a highly transmissible disease, and it works. Quarantine works. Masks work against viruses at an individual level. And so I guess I'm having a hard time understanding how these NPIs are different, because we use these tools every single day with respiratory viruses. I think the other thing that you said, Stephen, was around that none of these conversations were happening. They were. I was in the room in Texas. We opened schools in August of 2020 in Texas because of a lot of these conversations. There's a lot of trust jumps. We had to make really hard fucking calls with very little evidence. And looking back, yeah, we pat ourselves on the back in Texas because we opened schools in August 2020, but it could have easily gone the other way, especially with stupid viruses that really typically impact kids a whole lot more than with COVID-19. I guess, so my question is, in the beginning day, let's say March 2020 to August 2020, what would you have liked to seen public health do if it wasn't implement NPIs, because that was literally the only tool we had at the time?
We're not epidemiologists, and a big part of the argument of the book is that there were grounds for a reasonable debate and discussion about these matters. In fact, there were different policies pursued in the different states. We talk about that. Francis can talk more about it. It became a very partisan pandemic.
Yeah.
Republican states opened much more quickly than Democratic states. There was certainly something to be learned from those states and their school reopenings, both there and in Europe, in the Republican states in Europe. And yet, in many Democratic states, the schools stayed closed for much of the 2021 school year. We think that by that time, certainly by the fall, and even over the summer and so on, there was learning to be done because there had been schools that were open, and there should have been more open debate heading into the fall, and there was good evidence for reopening schools, certainly in the fall of 2020. A big part of the book is about the lack of debate, lack of critical discussion in many states. Texas, where you were, seems to have worked out much better. But in many parts of the country, there were not open debate, and there was intolerance of people that were dissenting and seeking to debate these matters. And that's a record that we show rather, I think, effectively in the book.
And we don't take a strong stance on the question of what should have been done initially. We don't really see that as our role, but we do raise the question about learning over time. And it was so striking how little effort there was to learn from the schools that were open in Europe in spring of 2020. They mostly reopened. And then when schools reopened in Texas and across the South and the Plains and the Intermountain West in the fall of 2020, why wasn't there a concerted effort to study those? And so that the schools on the coasts could have taken a lesson from what was happening there. There just wasn't that quest for information, recognizing that there was a lot that we didn't know about how to handle a crisis like this. It seems that we locked into a certain set of approaches and just kept pursuing those without a whole lot of interest in re-examining them.
And the debate here was much more polarized than in Europe, it seems. The Scottish epidemiologist Mark Woolhouse, who seems to us quite a sensible and well-informed person here, he actually supported the first lockdowns in the UK, and much on the same grounds that you all have, that something needed to be done. People were panicked, weren't sure. There was a lot of uncertainty, and he supported the lockdowns. He thinks in retrospect there's lack of evidence to show that they were efficacious, but he did support them at the time. But he's very clear about the learning that took place to a greater extent in the UK than here over the summer of 2020. Here, fears across the population range were fanned by the media, by efforts which also took place in the UK to make people more afraid. In many cases, it's very clear in the UK that the government advisory group sent emails to the BBC, which we have, saying that young people are not sufficiently fearful because of the low mortality rates in their demographic, and we need to ramp up the fear levels. We see that in some of the early books that were published about the COVID pandemic. Dr. Sanjay Gupta's book starts with 4 vignettes of people who got seriously ill or died of COVID, and they were very unrepresentative cases of people who were quite healthy, athletic, young, and so on. As Francis says, we're not epidemiologists, we're not public health experts. We're reporting on decisions that were made on what appears now to be a highly politicized, partisan basis. And the lack of learning that took place in places that kept these measures in place longer. The costs of these measures, which were predicted to be very considerable, and which do seem to have shown themselves to be very considerable, the lack of evidence for their efficacy, and the ways in which democracy did not function very well under COVID. The need for critical debate was short-circuited, and scientists were not open to criticism in the way that scientists are supposed to be. Journalists were not questioning public authorities in the way that journalists are supposed to do. And we think that many academics as well have been too slow to ask questions about the effectiveness of the measures that were undertaken during COVID.